Hello, everyone. Hi, welcome to our channel. This is Weifeng speaking. I am the microsurgery teacher in UW Medicine, and today we have two special guests, Ferris and Nada. Ferris and Nada, they spent 1 year in our division as a research fellow. They did an amazing job, and now they're getting started their rotation. And yeah, so today we will practice some microsurgery, and I want to help them to set up for success in the microsurgery. Yeah, and first, Nada, tell us a little bit about you.
My name is Nada. I'm a medical student at the Medical College of Wisconsin, and I'm a craniofacial research fellow right now, just finishing up the research year and for our sub-Is right now.
Yeah, my name is Ferris. I'm a medical student at Texas Tech University, finishing up my research year in just general plastic surgery and microsurgery stuff. But yeah, finishing up my sub-I here and looking forward to hopefully a career in microsurgery in the future.
Yeah, great. So last time I give Ferris a lesson, and then today Ferris and will helping me to see how we can help Lada in the microsurgery intro. Okay.
That's great.
Let's do it.
No, all in this micro. Okay, now microscope and the instrument are our best friend, so we need to know them very well. And the microscope, it has been developed for a long time, and the microscope we know now is pretty advanced. This one is from many years ago, but the major basic part is still the same. So you come inside. So and third, also this one, this is the eyepiece. So well, mostly everyone knows this one. When we turn this one, it changes the diopter. So the first thing when we go to the OR, we want to set up a microscope to match our eye first. So that's we work on the eyepiece first, and then after that we move the microscope, adjust the microscope to focus, so we can see clear. But the first step is to make sure it matches our eye, because everyone's eye is different. So the first thing is the interpupil distance. When it matches our eye, the interpupil distance match our eye, we can see one field. If that's bigger, it means the field will be separate. If it's smaller, if you overlap and make it smaller, not a whole good triangle shape. So the first thing is here. If you have a prescription, you have measure your eye, you know the number. My eye is like 68, and if you don't know, you just starting from small and then go bigger until you can see clear. And after that, here is another part of the eyepiece. We want the eyepiece like can look straight. So when we sit there, our foot can be able to touch the floor, and our elbow can be like almost 90 degrees, and we look straight. We don't want to look up, and we don't want to bend our neck to go back. But sometimes it's not so optimal, you know. Sometimes you maybe have to sit on a very over position. So that's sometimes the microsurgery is but try every possible to make you feel comfortable in the best posture, and then you can kind of survive with that 3 hours, 4 hours, even 6 hours, 12 hours. And the second part is this one. You can see here is class minor, class minor. So first, you remember this one? So this is the diopter of the lens. Like if you change to move to the last side, this lens will become glasses for the far-sighted people, like the senior people. We need to wear reading glasses. So the same thing. if your eye is normal, make sure put it in here. Put it in here. And this eye is for the nearsighted people. And most of the young people, I mean, when their eye has some nearsighted, and if they didn't wear glasses, you need to put the glasses, you need to change the lens to here, so you can correct your eye. The point is, only when you correct your eye by the eyepiece, you can see the same focus level of the other side. Like for me, I have some nearsighted. When I was in college, I never wear glasses because I really don't like that. So I need to move the microscope, this lens to here. It's about 1 or 1.2 or something. And then it correct my eye. So we can see the same focus level. If I set up the microscope in here, when I can see clear, you cannot see clear. So that's the problem. So if you are a teacher, if you set up a microscope like that, your student will know where you can see clear. That's the problem. So that's the first part. And for the second way how we can use it is when you go to the OR and your teacher is doing microsurgery, that means he can see clear. And then you sit down, you adjust everything right, then you sit on. You cannot see clear. That means there may be something wrong with the microscope, or your teacher at the beginning forgot to put it back to the left side. That causes the difference of both sides. So in that situation, this method can save your day, because if you cannot see clear, it's no way you can help, because the vessel and suture is really delicate. You cannot see it. So in that situation, you can just close your eye and then turn this one, no matter it's turning to left or right, and until you can see clear. It's kind of making a prescription for you immediately. You know, the best way is to tell your teacher and then see if you can set up the microscope again. But if you don't want to interrupt the surgery, this is one way you can help yourself on this side. So that's the eyepiece, and here's the here's number 10, and here's 0.7. So now you can step on this one. Step on the zoom. Yeah, it's nice seesaw. Going go all the way. That's 0.4. Now the magnification is 0.4 and 10. Now it's 4 times magnification. You can step on and zoom in all the way. Yeah, so now it's 24. And 24, we can, after we can go under the microscope, see what has been changed under there. Okay. So that's the microscope. So when we make it match our eyes, and then we move the whole microscope to make it see clear. Okay, now you let us see here. First step. You can use this chair. This chair is a little higher. You know, this chair is for
tall people.
For pee.
Yeah.
Yeah. Send it so fast. Far. Yeah. Yeah, after you match your eye, and then you can move the microscope. Zoom out the microscope first. Zoom out. Now move the whole microscope for the rough focus. No, don't change this. This one now is match your eye.
Yeah.
So don't move it now. To make focus, you move the whole microscope. Move the whole microscope for the rough focus, and then you can use the foot control for fine adjust.
It's not focused.
I do.
If not focus, don't change the eye because now it's match your eye. It's good now. Move the microscope. Nearsighted. So are you wearing contact?
No, I just have glasses looking at it.
So your eye is normal, right? Okay, now we can use first as a sample to set it up first. Now you can see clear now.
No.
Yeah, we move the microscope to see to make it.
Okay.
Yeah. Because we know your eye is normal, and then we can use you as a reference.
I think this is clear. Is this clear enough? Yeah. It's clear now.
Yeah, it's good for you also. Also you.
I only have a teeny tiny.
Yeah, you.
But
And then we can push the fine focus.
Yeah, you can. Now you can test the fine focus and see what happens. Wait. No, the foot control. Yeah. Yeah, to pedal.
that's pretty focused.
What is your activity?
6.
16. Okay. I think we're good left. I think we might need something as a reference to.
Can you take a look? No? Good? Yeah. Yeah. So that's the way of set up the microscope. Okay. Now, and here, like so it's standing like this is the. You can see here is the indicator, right? It's go when we focus, it's go up and down. But the fine focus only has like this much. That much length can go up and down. So for at the beginning, we should just move the whole microscope for the right focus. Because here we only able to move like 1 inch up, 1 inch down. And we also want to put it into the middle, so we have a capacity of adjusting it. Sometimes the microscope is already all the way down in the microsurgery, then we want to adjust a little bit. It's already down, so you want to put it in the middle. So most of the microscope now they don't have this indicator because this is the old style. They move the whole piece up and down. Now the microscope they use internal motor to change the lens like a digital camera. So sometimes you may see an indicator like LED here, but sometimes you don't see that. And some of the microscope they have the laser indicators which can see it and emerge as focus. That's very good. And to set it up in the middle, my way to set it up is I press the button, focus on the handle going down, all the way down. Then I press the button going up again. And then I starting to counting like 1, 2, 3, 4, 5, 6, 7, 8. And then I press it. It's kind of like that go 6 seconds, you go all the way up. And then I press it going down again, like 1, 2, 3. That's almost has in the middle.
Yeah.
So we have the capacity of going both way. Yeah, so that's some of the experience there. Okay, now I want you to take a look at the ruler. Okay, tell me what is the diameter of the field now?
About 50. Like, I don't know if you got that high.
Hmm?
Yeah, it's like the 30 and 20 or I think the 30 is like twice the middle.
Hmm.
Yeah, I can do that now. It's like from 15 to like 7.
Yeah, it's a reflection is you have asked
Or we can turn the
50
intensity of the
like-
light down a little.
Really
What? What is it now?
Okay, so we don't need to be very accurate. So tell me the diameter of the field.
Okay.
it's about 40.
Oh.
Yeah.
Hmm.
Or 16.
So,
It's like 16.
Yeah,
okay,
it's about
right now?
Right.
Yeah.
Ooh.
No, that's not. Just write down some number. Right? It's 4 times magnification.
Okay.
The diameter of the field is 60. Press,
Are that diameter of the field should be the same between both of us, right?
yeah, should be the same. Yeah. What? How many centimeters can you see? You can move the ruler so you
I
can.
can see from 10 to 50, so about
16, right?
40. We can max the direction.
It's fine. Yeah. Let me take a look.
Yeah. Look, see if I have an undiagnosed.
I can see 1 to almost around 6.
Yeah.
Around 650. Yeah.
Yep.
Mm. Yeah, it doesn't matter. You can see clear. That's the point. Okay. Now zoom in the microscope. Yeah. Yeah. Zoom in the microscope all the way.
All the way?
Yeah, all the way to 24 times. Yeah. Now, because focus. So now we move because it's our focus a lot. Oh, zoom out the microscope. Yeah, I forgot to measure. Yeah, zoom out again.
All the
Zoom
way?
out all the way. Yeah. Yeah, that's by the seashore you said.
All the way?
Okay, I want you to take a look at the depths of the microscope also. So, how many mirrors you can see clear. I mean, very clear.
It's like 30. 40. It's like 30 or 40. It's for real?
No, not from here. Now it's in good focus, right?
Yeah.
Okay. Now, how many mirrors yes. I mean, need to be very clear, no blurry at all, because it's kind of the depth we want to do survey. If there's the blurry, we don't want to do microsurgery at any depths, okay? Yeah. Don't need to be very accurate, yeah, just 30.
Yeah. 30, yeah, 30.
Okay, okay, like 30, yeah. It's, okay. Now that's the depth you can see clear. Okay. Now zoom in the microscope to the 24 times. Yeah, so like how many, what is the diameter of the field you can see? Oh, yeah, oh, now it's our focus a lot. So remember when we use the quick control can only adjust 1 inch. So it's not, you should just move the whole microscope for the broad focus. And then use the quick control for the fine focus. Yeah, you can see move up and down and see what
Close enough on focus.
Yeah, make sure it's very sharp the imaging. You can see the fiber and also the texture of the ruler. Okay, yeah. So what's the diameter of the field now?
8.
Yeah. Yeah.
8 and
Okay. Yeah, you can write down. Let's mirror that. Yeah.
What is this? This is
Now take a look at the depths. How many mirrors that we can see very clear?
yeah, 2.
Yeah, 2. So there's only 2 mirrors that you can see clear. Now I want you to kind of imagine there's a box or space. We can do microsurgery. In 4 times, this box is like 6 or 4 centimeter wide and 2-3 millimeter high. Like this space we can do microsurgery. Out of that is blurry. We cannot do stitching the rest of it. And then when it goes to 24 times, this space becomes and then only 2 millimeter high. So that's the box we will stitch it there. So it will become really hard and very minimum. Out of that, we pull out a little bit, out of focus. Pull out a little bit, focus, pull out a little bit, out of focus. So it's become very hard and then also require higher skill of our hand. And when it's out of focus, our eye, the muscle inside our eye, they want to constrain and then try to make our eye can see clear. That's naturally of our brain. You don't want our eye don't want to see things blurry. Maybe if the blurry, your eye will focus by itself, by the brain. So it's another reason of in a high magnification, we getting fatigue quicker and easier. So I want you to experience this process is to want you to tell you in one of the principles of microsurgery is you don't want to go to see, you don't want to just go to high magnification and see things bigger. The principle is we go to the lowest magnification and can see much bigger field. When we can see the lumen, that's it. You don't have to see the lumen big, and then really hard to insert. So some of the, before I measured it, I thought simple microsurgery, we may need to go to 30 magnification, but actually it's no. I measured it, then it, like even the 0.5 millimeter vessel, 0.3 millimeter vessel, we can just do it like 12, 15 times. You don't really need to go to 20 times magnification.
Yeah.
So sometimes we thought it's true, but it's not true. Okay, that's one of the things I want you to know after this experience. Okay? And then you set up a microscope. So set it up. Now zoom out the microscope again. Now you can see clear, right? Okay, then zoom out the microscope. Yeah? Okay, now it's still focused, right?
Yeah.
Okay, zoom in the microscope. It's staying focused,
Yeah.
right?
Yeah.
Now remember, at the beginning, when we zoom in the microscope, it was focused.
Yeah.
And this time, you zoom in and zoom out, it's staying focused. What happened? So we want the microscope stay focused,
Yeah.
right? So what did we do to make that happen?
We zoomed it in all the way and then focused it. So that it's going to stay in focus.
Yeah,
Yeah.
yeah, that's the way of. So that's the way of setting up the microscope. But what made that? How we can make it happen? So now I want to talk about the depth. Now we know the depth at the beginning is like depth like this way, or this way, and when it is in higher magnification, the depth is this way. This is number. In the real surgery, in the real circumference environment, how we use the depth is now. Now this junior the depth. At the beginning, at the first time when we set up a microscope, at 4 times magnification, maybe the depth is like this way. When we put the ruler there, the ruler may be here, and here, and here. You can see clear. And when we go out, zoom in the microscope 24 times, the depth becomes smaller. So in that situation, when the ruler was in here, or even in here, very close, when the depth becomes smaller, you cannot see the ruler clear anymore. That's lose focus. That's the first time. And then when we at 24 times, we refocus the microscope. That means we move the microscope and also use the fine adjust, make the ruler within here. And then now we zoom out the microscope. The depth becomes bigger. The bigger depth will definitely include this for depth inside. So that suggests us we should set up the microscope in lower or higher.
Yeah.
Yeah, we should set up the microscope in the higher magnification. So when we go to the lower magnification, it stays in focus.
Yeah.
Instead of we set up the microscope in 4 times, we going up a little bit and then we need to focus the microscope. So that's more convenient. Like for example, we do a finger implantation. We may use 6 for the digital nerve. We may use 8 for the distal artery, and the way we use 10. So we change. So if we set up it by 16 or 20, we may not have to go all the way up. We can, according our experience, like we go just to a higher magnification, and then set it up. We can stay focused. That's more convenient. Okay. Yeah, that's the practical part of the depth instead of just to lumber. Okay. Now so far that's the microscope. Any question?
Oh,
Yes. Yeah. 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 That's the one of the very important part they when they invent the microscope. Make sure the person can see the same thing. Okay. Now zoom out the microscope. Yeah, zoom out the microscope.
no.
Yeah, we have microphones. So for the microsurgery, the instrument, now we talk about instrument. Instrument, now we see a lot of instrument. So basically the micro instrument, there's only 4 instruments. Needle holder. Oh, yeah. Oh, yeah. So this is all needle holder.
These are scissors, right?
Yeah. Yeah, this is the needle holder and scissors apart. Oh, it's an instrument, right? It's micro instrument is all from the regular instrument. So there's no way when our pioneer they developed the microsurgery, they don't have instruments. So it's all kind of the idea is from general surgery instrument, but they just make it smaller and easier to enter the microscope. So that's not too much difference. So okay, now let's talk about this orange micro needle holder. So what is the difference? You can see.
A little bit bigger.
Stronger. Yeah. Yeah, this tip is a bit curved. So smaller. Yeah. Yes, really, great. So the most important part is the tip, because the money is most of the money. Once the tip is damaged, mostly. And the finer tip more expensive. Like this one, the tip is smaller, finer, and thinner. And so this way is like 1,500. Like this is like 4,500. And also I can see the difference is the flat handle. This is the flat handle, this is the rounded handle. It's like probably like a flat handle. All the rounded handle instrument from this pen higher to the lab. I see that is also. So, and this is the titanium instrument. This is stainless steel. The big difference is the titanium instrument won't get magnetized. This stainless steel will get magnetized slowly, and it's annoying because when we get close to the needle attached to the needle holder. So sometimes we need to demagnetize it. That's the demagnetize. Yeah. No one they also have one of that. Yeah. And now we can take a look under the microscope. Let's just keep doing that. This one is very strong. So this one is the standard set for the plastic surgery, like if do DIT or ALC. So you can see the tip is pretty strong. And this one is the tip is smaller. This is what the next we have instrument. But then I usually the curve is a little bit too much. Like this one, the curve is a little bit gentle. This curve is a little bit too steep. So making it a little bit different when we usually. And this needle holder and scissor combined, it's good for when you have to do surgery. Only have one person, no assistant. So I bought this one when I was doing a kidney transplant for the transplant lab. In the Lowden facility, there's no people can help you. And the microscope is facing the wall, so nobody can see the other side. And the protocol is one with kidney time only allow 30 minutes. Wow. That means I need to finish the kidney transplant within 30 minutes. I cannot, most of the time I set it up very well, take the kidney out and then start the microsurgery, blood osmosis. And most of the time, 30 to 34, 35 minutes. Because after I tie a knot, and then I put it down, I have to put it down, take a scissor and then cut it, and put it down, pick up the needle holder again, and then start the next stitch. When you don't have a system, you realize, wow, how important to have a good helper. So I remember I saw one of these, then I bought this one. So I don't need to put down the needle holder again. So I finish the knot and then I cut it, and then I pick up the needle, start the next stitch. So making me save my 5 minutes, and then I can get done like 28 minutes of the kidney transplant. But sometimes the problem is I cut the suture.
Oh yeah.
Before especially when I'm doing the vein, I use running suture. And I running in the half, and then I cut it. Cut to start again. And then I realized I should always hold it close while I was moving. Only when now this is the needle, I take it out. Or sometimes the suture get caught in here, and then I realize it. And then I pick up a needle, cut the suture. This one is pretty tiny and thin, so it's only designed to pick up the 11-node suture needle. Don't use this big needle. Don't use it on the big needle, because when we hold the big needle of this very thin tip, we holding the big needle. When we squeeze it really hard, the tip will open, like become like this. Usually, most of the time it's like that. The needle is staying still. We won't kind of squeeze it. So when we hold it too strong, and then the needle holder will become like this. So if you use it in a good way, it can last for pretty long. Okay. Now we talk about like this is a standard set for the plastic surgery. When it's standard, we are talking about the diameter of the tip. It's 0.3. See? It's very close, small. And like this one is also 0.3. But this one is a little bit thicker, it's like 0.4. But this one is 0.1 tip. The idea is a little different, it's like thinner. And also this is not the original tip. It's retired from the OR. This one is like close to 0.1 tip, which is a nice one. So that's the difference. In a hand surgery, we may use a little bit smaller tip needle holder. In the simple microsurgery, like we use this, like the lymphatic surgery, we use this one. Try under a microscope. Oh, yeah, this one is the locking needle holder. Put it under the microscope to see how it locks. Now you see, the locking mechanism is like there's a hook, a latch. When you reach the hook, it locks.
Yeah.
When you press, it goes further and then lock it. Yeah. Most of the time, we don't want to use the locking needle holder because once you lock it, you have to use extra step to unlock it. We want to use it just freely. That's better. But another hand, when if we use the locking instrument to catch the needle and then save aside, so we don't need to worry about the needle. The micro needle we lost, most the needle. Yeah, and here's some number I want you to read. S and E. How many? C is the curve, and it's 14 centimeters long. The length is 15 centimeters long, and here's the RC is the round handle. Curve medium for the width is 0.1 millimeter. That's another one. Okay, now let's move on to the scissor. These two, you can see these two is bigger one. That's also a standard set of a PR plastic set. And this two is the really smaller one. That's like this plastic surgery, hand surgery, super microsurgery. The plastic set is like the blade length is like 2 centimeters. And the tip of the joint is 2 centimeters.
Okay.
This is the hand is like 1.5. So the tip of the joint is like 1.5. This one is a little bit smaller, it's like 1.2 centimeters. And this profile is the can you see that?
Yeah.
Here's the 1.2 centimeters. The tip of the blade. So, and the straight scissor, the needle and curved scissor. And the scissor they have special name, then we look at here. SFP, right? So SPC 15. First S is the scissor. D is dissecting. C is curve. Curved scissor for dissection. That makes sense, like when we, in the general surgery, we also use curved scissor for dissection. The 15 centimeter long. This is the straight scissor. The straight scissor is like SAS 15. So the first letter is straight. A is a scissor and adventitia straight.
Okay.
So adventitia scissor straight, 50 centimeter long. So, but actually, like when we use the textbook, Google textbook, when we're talking about adventitia, clean adventitia, the textbook you saw us like pull the adventitia out and then they cut it from here. That may be the reason they name it adventitia scissor. But actually, most of the time, that's too good to be true. We cannot hold the adventitia like that way. Most of the time, we can hold the adventitia like that way. The rest was damaged. The adventitias get developed from the needle layer. So usually we still using like a forceps holding on the side, using a curved scissor to cut the trim from here. So actually the adventitia scissor, most of the time, or the straight scissor most of the time we use it only for straight cut. You don't use it for the adaptation. On the curve seater we use for the
So they cut it into like the vessel.
yeah, straight cut we only use for making a straight cut or make a special for the yeah. Yeah, this one, I'll put a look here. This is SEC 80, and then first ethnic,
Scissor.
Dissecting.
Curved.
Curve.
18 centimeters.
R. R is the round handle.
Round handle.
Yeah, round handle, and A is the A millimeter of the diameter. So we have some millimeter in this species. The handle diameter is the global standard, or we all make it at A millimeter. Sometimes in ophthalmic surgery we make it like 7 and 6, a little bit smaller. But in microsurgery we all make it like A millimeter. Okay, now that's this one. Now take a look at this one. This is even more rich there.
Scissors. Dissecting. Curved. 15 centimeter. Round handle. 8.
So this F12 is a little bit different, right? So the F is 5 blade. That means the blade is smaller. And 12 is the blade size, the length is 12 millimeter. Take a look at this one.
Scissor. Dissect. Curved. 15. That's fine.
5 blade, 12 blade. Yeah. So the same information is to see that. But you take a look which one is better. Final, I mean.
The one on the top.
Yeah. Yeah, this one is final. So I tell you a story. This is the only one we have, this supervised system, and it's $700. And we use it many times, it's getting blunt. Although we still can cut the paper and something, but when we going to cut the tiny nerve, cannot cut it, getting blunt. So I want to buy a new one. And then I put all this information in Google, and it comes up, this one. And the price is like half of the price. Oh, that's good. Then I buy this one, I bought this one. Then I got the product. Oh. Yeah, not the same. So different company, they have concept of 5 blades. So in here, this one is kind of, it's very similar to just this one.
Right? Hand scissor, that's not much different
Yeah.
from
This
this one.
So that's the
SMT
SMT.
scissor.
This is the dominant
company
company in
SSI
the
in
most of the
the
instrument from
from
their
their
company.
companies.
But they not most of the instrument I see that they are the same, but when it goes to smaller thing, the SMT has a higher standard and higher quality. That's why I see. Okay, that's Caesar. Okay, and now this is the forceps. Forceps. Yeah, it's fine. You need to check the phone.
So you have to be very careful to always check the supplier whenever you're buying instruments.
Yeah. You don't know until you.
Until you have it. Yeah.
Yeah, you can handle it a little bit.
And go to get some water.
Yeah.
suture. So you can plate while we are waiting.
This is the hardest part, is getting it out of the box. Once you're there, you're home free. Yep. It's magnetized. Ooh. This is what Weifeng was talking about, how it's magnetized.
I want to. Do you want to just try switching to the
Yeah,
titanium?
sure. Yeah. Oh, I was just saying, you see what happened to it? It's alright, we can do it again. Actually, maybe this will work. That's alright. I find the hardest part is just manipulating the suture and getting good at picking it up.
Did he teach you the trick about like grabbing the suture and pushing the needle onto the?
Mm-hmm. Oh, like grabbing the
Yeah.
the suture, yep. Yeah. Otherwise, it's really difficult. And then you position it.
Yeah, the easier way is to putting the suture and then
Angling the needle.
Yep.
Go a little bit to the center here. Just to put in the microscope.
just in the people is different. Careful from the.
No.
Yeah, nice. You still remember that?
Try not to tie them down, but
Yeah.
Why?
I don't know, just because. Just
There's
not.
the potential square now. For the not straight. Okay, and let's go back to the scissor. So scissor is done. You
The pickups.
yeah, pick up. What's that? So like this, the first up.
Yeah, and that is down from the first up.
So you can see, I would say like this,
Let's go back to the
standard one, but this is standard first up.
Standard first up.
You see this is stronger, this is not so stronger, but the fiber tip, when it goes to the standard, it's also going up a lot of the tip. The tip is 0.3 millimeter. You see this one?
Yeah.
Maybe. So, 0.3. And this one is maybe a bit smaller, 0.5, right?
Yeah.
And this one is the rainbow one is the finest. It's the original size is like 0.1 tip, is like half of this 0.1, 0.05 tip. This one is a little it's so close to 1.1 because we got damaged and then we fixed it in the lab. Just use a sharpen stone and just slowly sharpen it. You can see it designed very well. See, it's like the clamp of the crab. See that? It's only the only the tip has together. So you can make it and pick up something very accurately. And this one has a longer tip. You can see the tip is can touch 1 second on the tip. That you can pick up very good and also can pick up a suture. But when it goes to very small structure, this finer tip, this one, it's easier to use. And also service is good for something like passing something from the vessel or artery. Yes, I want to show some data.
Information is here.
So, S&P,
Jewelers.
ruler fossa, and speed, what's the speed? What precision?
I'm not sure.
So ruler fossa. So we still name it as ruler fossa because at the beginning when we do surgery we don't have instrument. So we went to the ruler store and then follow the fossa. So it's also a ruler fossa angle. Is it long?
Mm-hmm.
This 3 is 0.3 tip. this is 10-meter comedy. The lens is 12 centimeter long. Point 0.5 vertical tip.
What's the HR?
HR. Good question. Yeah.
Weifeng, for these, why do they, why is it like a small push?
opening at the tip.
Yeah, it's designed to pick up the suture or pick up the tissue easier.
Oh, okay.
Yeah. It's very easy to damage one side. That's
Yeah.
the problem. It's a very good device.
Yeah.
Yeah, and then other than that, the last instrument is the dilator. Dilator is so this is the dilator. The dilator from outside looks like very similar to the forceps, but you can see the tip is a very different design. Shiny, smooth, not polished, and also the tip is table tip. So you can put it into the human. This one is the damage on the top. This is the final one. This is the point 1. This is the point 3. So sometimes you can see the teacher they use the dilator to when they're doing the stitching. Because the dilator can touch 1 segment of the tip. That making it easier to pick up a suture.
Oh.
I think about if you use this forceps to pick up a suture, you need to squeeze really hard, or only when you can pick up a suture on the tip, you can pick it up. That's hard. So that's one of the problems. So the dilator usually like that, the vessel can be handling it many times, and it goes to a room temperature. But most muscle will be able to contract and slide down. And so before we do that, as most of people like to put the dilator to make it go back to normal size. Or in some situations, we want it to go bigger to remove the discrepancy of the second vessel. So that's when we use the dilator. Here, D dilator, 5-inch angle, 0.1. Why it's angle? Some of the dilator is really look like this one. It's straight. The thing about the vessel is staying flat. When we want to put it to movement, like this angle making it lower profile and then easier to put it to movement. That's why it's angle dilator. This one is also dilator 1.5-inch angle. So standard 1.3 to didn't extra like the different company have different a little bit different of the labels. Okay, that's all the instrument. And then other than that, this is the mirror dissector, easier to use. This is the this is per forceps. You can see forceps they make a platform there. That platform is designed to pick up a suture easy. You may not see everything in the OR here and there, but when you see this, now you can understand one more of the instruments. Now, let's the box on the edge of that, all the way back. Oh, sorry. Okay, open it. Have you guys used the cover?
No.
The cover is very well designed. So this is the hockey stick. This is the mirror. So the hockey stick is to brush the vessel on the tip. This is the dilator. This is the here, arrow, and the arrow, and the arrow is lost progress, so we go.
You try.
Opening down there. I'll push it away.
Yeah. Here the click. Okay. Oh yeah. Yeah, hello. One of the microscopes.
That's a couple.
Now this
So this is now.
you can see that
Yeah,
here.
yeah,
Yeah.
I see it, yep.
So in diary that we
In a couple of
hold the vessel from here and then
Put it on the hook.
usually then put it on the pin. Right? The, the difficult part is kind of like pieces coming in here, 1, 2, 6. So usually we would like to put one here, one here, make a triangle. So it's kind of even the space in between of the pins. And it's the similar method we place the stitching on the vessel. After we put the vessel in both sides, now we turn this one, and turn it. Let's see what happens. So that to arm, and especially it starts squeezing and then it makes it close. When it's closed, when we close it and then we use a heater set to kind of close it, squeeze it, it's really pin can go into the other side and stabilize it. And finally it comes into this gap, and then this finger is kind of going here and push the top back out. So it's very well designed. One thing important is when we put the pin on, I always kind of straight towards the pin. If we push towards that side, the coupler will go out of the slide out of this socket, and then you have to use a new one. Yeah. So when you move it, press this button and then
You try.
Okay, very nice.
usually when we put after we put the vessel on, I mean this is the stepping vessel. Mostly the stepping vessel we won't be able to move so much, so we will stabilize this one, and then we turn it. When we turn, we try to bring the stepping, bring the flap vessel towards this side, and then keeping this facing down.
I see. Okay.
But if they are both sides enough length, you can just put it in the middle and then use this hand to stabilize it. So you can see there's a hook inside. There's a hook inside, so you press this button to release it from here. This is how the ornament way and osmosis and outside of this. It's too expensive. It's too hassle. Okay, that's the instrument. Any questions?
No? How do you use that?
Very simple.
Oh, you put it inside.
Oh,
Yeah.
Wait, where?
Yeah, you should try it. Holding it.
Hold it. Yeah.
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 Caught me off guard.
If you touch the wall, if you magnetize, now if you want to magnetize a screwdriver, screwdriver is good to magnetize, so that the screw can attach it. So you just touch it.
Oh, you touch it on the inside.
Yeah, if you want to demagnetize it, just don't touch it and then go in and out, demagnetize it.
Okay.
So it's it uses both ways.
That's cool.
Those are very
Very
expensive.
expensive.
$100,
Oh, okay.
but it's
Like I put the
Oh.
tooth back in there.
by this moment it can only magnetize five instruments. So
Oh.
one day I brought every piece instrument got magnetized to Sam's office, and then Carlos, Carlos, the microsurgery nurse, and he bring one of his out from nowhere, put it on Sam's office. I was very happy because I want to demagnetize
Yeah.
all of them. But what happened is after I demagnetize five, it's already overheat, and then I have to
Wow.
cool it down, and then demagnetize the other things. Eventually, just impossible.
It just takes a long time to cool down.
Yeah.
Okay.
I think it's already a little warm just from putting it.
Yeah.
Wow. Yeah, it's kind of.
Yeah. Did you talk about the suture last time?
A little bit, I think.
Yeah. So the suture is also one of very important things. When I didn't realize it until I have so many sutures, because like they have like 9, 10, 11, 9, 8, 9, 10, 11. That's most of the suture we use in microsurgery, in plastic surgery, and also bowel. So usually we only need to remember if you want to remember 11 node is used for the vessel stuff miracle. Less than 1 miracle we use 11 node. Yeah, and then this one is 1 to 2 miracle. It's like a finger you can push to. 9 is like 2 to 3. It's like a DIT. Oh no, the ALT for the radial artery and ulnar artery. And this one is like 3 to 4. That's a big vessel like DIT, IMA, that's also. The parallel is when we going to like less than half mil. At this one,
Yeah.
we still need to put 4, 5 stitches there. If we have parallel, yeah, parallel is a little bit better than 11 node. But that's not always available. Now, one the microscope this one. So we start from the AO. So first, yeah, see if you still remember that. Tell me the information on the package.
So, so it's nylon suture, filament, NATO, size. This is the needle, so it's a taper needle, it's 5 millimeters. BV, I don't know what that means.
Broad vessel.
Sorry?
Broad vessel.
Broad vessel?
Yeah,
Okay.
broad vessel is kind of one of. It's special for the lectures and the sources.
Okay.
So 130, that's the diameter of the needle. So this is the suture information, this is the needle information. 130 micron, 5 millimeter long, paper tip, 3/8 circumference. Paper tip is considered as a traumatic needle. But the cutting needle is for skin most of the time. Because it's sharp, and kind of go into the skin easier. The rounded body tip is considered as the traumatic needle. That's good for less. And take a look at this, it's the same AO, right? So the suture is like 0.4 metric. Metric is the pharmacology unit. Nio is 0.3, NO is 0.2 metric, like 11 is 0.1 metric. Like this 0.1 metric has unit is comparable to 18 micron. It's hard to relate to numerical image. That's hard. And the 12 is 10 times smaller than 11. So the needle, we understand the suture size, bigger number, smaller, but the needle is even more important. Take a look at this needle.
It is blood vessel, 130.
Now, this 3 is the category of the company, so we don't care. 3,
3 millimeter, 3,
3 is circle. 8. So the difference is like the length of the suture. Sometimes the length of the suture, sometimes it may be before the suture, the needle. So this one is smaller, this one is smaller. And I want you to take a look at this one. This is 11 suture, and the needle is also 3.8, right? This AO is also 3.8. So, but the difference is 11 we use on a submarital vessel. AO we use on a 3 to 4 meter vessel.
It's way too big.
Yeah. So for a bigger vessel, do you want a longer needle or shorter needle? Absolutely. So this is one of the see, it's still not open because I don't use this one.
Yeah.
This one's too short. It's not too long.
Yeah, this is too short. It's 3.8 is good for let's submarital vessel. It's not good for big vessel like a family. So this suture is from the stem cell lab. They made a synthetic vessel, bioengineered vessel, and it will ask us to put it on multi-family library. They asked me, hey, what suture do you like? And I put that suture. And then in the first day surgery, it's this suture. Every time I need to, after I put the stitch, I need to go into the movement and then pull this needle out from the family library. And I told them, okay, to leave the teaching 5 to 10 minutes. And since then, I realized the company, they not kind of designed by the surgeon. They just, okay, I have this needle, I have this suture, so they match each other and they draw it. And I see the same thing in an IO needle. So when I talk about this, if you go to a hospital, the microsurgery already well established. It's fine. You don't need to worry about that. But if you are the first microsurgeon, I totally you should be the first microsurgeon in that hospital. So if the nurse asks you, okay, Adam, what suture do you like? Don't tell them just buy an IO suture. Tell them like this, they can match the same, exactly what the suture you have. If the nurse buy you a whole box of suture, you may use it, you may suffer for years before you cannot do it away because it's very expensive suture. And this is something special, right? This is that special needle, which is not for the microsurgery as it's for EAS. Looks like it's vascular, actually it's vestigious. This is for the secondary reversal surgery. That vestigious is like this, the lumen is like so tiny. So this needle may not easily pierce. So they decide to stick on the needle. take a look at this one. This is panel. What's this one? Ophthalmic needles. No, it was amazing, so they can make a needle like that. I asked my friend, why you guys need this soup needle? They said, two reasons. The eye, like the onion, is really sticky. It's not like a vegetable. It's hard to pierce. And also, so they want to take a partial bite because they don't want to take the full thickness bite because the eye inside is liquid. The full thickness bite will kind of cause the leaking. Also, the bacteria may go into the eye. So they take a partial bite. So this needle is easier compared to this microsurgery, plastic surgery. So that's a little bit different. Yeah, that's the needle. I want to help you to buy something good product and the right person. In the microcourse, did you guys have chance to take a look at these problems?
We didn't use it photos.
There's a make code in there, yeah. There's one right there.
This is a
Yeah,
I just try. So that's the jaw. There's the capacity. Yeah, here. There you can see that. So now you can see this is this color is the 6 millimeter less needle, AOE, zero suture. This show the needle is like 2 millimeter. They have different needles. This is 2 millimeter. They have 2.5 millimeter. 做这够不了哦。
That's good. I was just trying to put them side by side.
Yeah, this is I can manage.
Wow.
Putting them next to each other
It
makes
makes
the
the
difference.
difference seem
Very
very
large.
large.
Yeah, so that tiny needle is very fragile. And it's only good for the vegetable because it don't pierce the particular vessel. Yeah.
These are all kind of magnetized.
Whoa. Now I see the magnet.
Yeah.
Oh my gosh.
You see what I mean?
And now you see it. That's not annoying.
Yeah. Very annoying.
Just take a dose bait.
Yeah.
Okay. Now, And then, yeah, maybe, yeah, so now pick up the needle and then put a stitch high enough. Yeah, and then I will, share you something. Yeah,
Is there an
We demagnify that.
yeah, see. Yeah.
Let me see if this one is.
The whole here. Yeah, sometimes hold here. And then just stand for the tail. And then go in and out. Follow it in.
Oh yeah, it's not mine anymore.
Oh, really?
That's crazy.
Sometimes you didn't want to, but
Yeah, I just did this one. It didn't work a second ago. Let's see if this works. Okay.
Wow, that's so cool.
So I'm gonna teach you something my thing taught me.
Whenever you're picking up the needle,
yeah.
If you let go of it, whenever you pick it up, the easiest way to do it is, so let's say it's like down like that, you kind of pick it up, just grab it with the pickups, grab the suture pickups, it's like right there, somewhere back up here maybe, and then let it fall like this, manipulate it into a position where it's easier to pick up while it's on the floor or against something, and then you grab it, so you can just like move it right here, and then you can grab it like that. Instead of trying to grab it in the air, but it takes a while to figure out. So if you do it, to get good at it, but grabbing the suture,
Yeah, stand in the needle.
dangling it is the easiest way to do it.
And let the needle touch the face, so you stabilize it.
There you go. You can play with it. There you go. Nice. Perfect.
Yeah. So really, you pick up the needle and then pass the needle to an instrument.
Yeah.
Sometimes that's really
Okay, so I'm gonna make a little knot here.
like when they get into
Yeah.
that,
Whatever, use whatever. Try. It's not all and wide.
Nice.
Yay. Try not tie it down.
Now you want to grab.
so
So
you're doing it
You
right.
can tie it down. Yeah.
Tie it down.
Nice.
Yeah. Doesn't matter. They're not.
Yeah, it's the first time.
Yeah, you have to be careful because it's really fragile. Nice.
First you do one and then you're doing it, say it. So,
Okay, so I'm grabbing it first. Okay, so
Really
first
first.
suture.
And
Now
I'll grab it
with
with
my pickups. Pull it through. Now
Pull
pull
it.
it through like this.
Once
Once
it
it
gets
gets
right
right
there,
there, I'll grab it again with my pickups here.
and
And
I'll
I'll
grab
grab it
close
close
to
to
me
me
like
like
this
this
to
to
where
where I can
easily,
easily reach around.
you
You can also flip
flip
the tips of the needle driver as well to make it easier.
grab
Grab
it,
it. The other best way to do it is the second one is to then kind of switch hands, yeah, so I then grab this one with my hookups.
Open the ball again. Long hand is
So easily, so.
Yeah. So just switch hands over.
Mhm. Yeah.
the ball hand. And sleep. Yeah, and then maybe it's on this part. You can hold it.
Grab it within your holder. And then same thing, pass it over.
Good. Assistant.
And then you want to cut, hold on, let me think for a second, so, yeah, so Dr. Moore said, yes, I'm gonna cut this right here, kind of close, and you wanna leave a tail. So you wanna cut it right here, you don't wanna leave that tail usually, cause it makes it easier to, yes, perfect.
Yeah,
Yeah,
that
'cause
saves
suture,
and then you need this tail here.
so you can,
Yeah,
manipulate it and lift it,
So that's
just,
Yeah, for the helper, for the assistant. Yeah, so both way, like microsurgery, at the beginning there's no microsurgery. So when our my teacher they do microsurgery in like 60, 70 years ago, they use the same method of general surgery. So here I want to tell you like what is the difference and how do we use what we have learned in the general surgery. General surgery, stitching, needle holder, we pick it out. When we tie knots, I still remember in one of the webinar, the professor said, resident asked them how to tie knots. Same way of tying knot when we stitch the skin. Use the needle holder, we look on the needle holder and then tie knots. I see box 10, the first one, then second one, the third knot, the third one is kind of box the hand again to tie square knot. And that's the skill we can translate from what we practice. But under the microscope, when we plot the hand, it's not easy. So we actually slowly we use a different small different method when we started tying knots. When we took the suture out, we try to avoid cross our hand. Actually, we already in the general surgery, we also have that method how to avoid cross our hand. After first, and let our hand tie out. Yeah, now we need to lay it flat, we need to cross the hand. Okay, now if we don't want to cross our hand, what can we do?
Don't want to cross your hand. Switch.
Yeah. That's this. Yes. Yeah, switch suture. But in the we switch the suture at the beginning. Right? Like when we like in actually when we were in the medical school, tie knots everywhere. Like you see here and there in our backpack, in our bum bag. Yeah, in the belt and we tie knots, just tie knot. But when my first day, what I see something is then the teacher they take the suture and then they naturally cross their hand. They cross their hand and then when they start to tie knots, they didn't use the same method to cross the hand. So and then I realized actually they passed the suture, they crossed the suture at the beginning, so they don't need to cross their hand.
You do it every now and then. Does it stay square?
Also, you go to the OR if they hand tie knots, they when they go to you can see if they do this way. Pull the suture out, and then gradually they cross their hand, and then they start to tie knots. So they don't need to cross their the hand like we are the medical student. That's that. So the first thing they cross. So actually, in the microsurgery, we do the same thing. Like when we that's what Ferris demonstrated. Yeah, when we pull the suture out, we starting by instead of using a needle holder to make roots on, we pass the suture to use the needle holder to put in the long end and make roots on the fossa. So the first night we don't need to cross the instrument. If we have to cross the instrument, we will boost the capacity of adjust the vessel, making it even. And also in the microsurgery at the beginning, if you need to think about how to cross your instrument to tie a thread knot, it's a little bit confused in which way to cross. So this method also, you don't need to think, just do it. Microsurgery is like training until you can. Don't take nothing. Yeah, okay. Now one thing I'm going to do is bring it in front of you. Okay? And then you don't hold the catch the suture. You don't hold the catch here. Yeah. Two things I want you to remember is one is bringing it in front of you. The second is holding the holding the long end, almost 3 times of the short end. That's a good length and surgeons now. See, so the first time you don't need to cross the instrument. And then you pass the suture. So the second night you don't need to cross the instrument also. So this is a special training that we use here when I teach the Western. Because in the training, pass the suture again. Now I'm just going to hold it with the suture. Good. Every time bring back in front of you.
Every time you should switch hands.
In the training, you know why you don't see that? This method is a training method, but in some difficult situation when you don't have enough space on one side, you passing the suture can make it easier. Why I say it's a training method because in the training it's a little bit different from the real surgery. In the real surgery, in the OR, it's kind of, I always use that, it's a rappel, like a karate competition. When we go to a sports competition, we all just want to use the best skill to KO the other guy. That's in the OR. In the OR, the teacher, they use their best skill to get their surgery done fast and safe. And that's sometimes kind of like a rappel, tornado king or what kind of thing. So the teacher, they use their best skill. And the best skill is all kind of like a tornado king. Think about if we are the white belt, we go to the gym and then want to do a tornado kick. Most of the time just fell on the floor. So we do, the teacher, they are doing in the OR, is kind of doing a tornado kick at the first day. And don't forget the rappel, they also start by one punch and one kick. So this method is the punch and kick in the practice at the beginning. The goal is to improve our hands dexterity. Okay, folding the long end like 3 times on the short end.
So, alright.
Okay, now,
Good,
yeah,
Right. Lose focus. Is it clear for you?
Yeah, it just got a little
Oh,
bit
there we
less.
go.
It's because
Thanks.
it
Bubbled up.
went up, yeah.
Pass what you need. Oh. Punching in.
I can maybe help you.
No,
There
good.
we go.
try to take the needle out by the needle holder.
Yeah.
Because the first step tip is really tiny.
Yeah. Okay. So you're saying so where I would. I would usually go around my needle holder, just
Yeah,
switch
that's
hands
Mm.
and go that like that.
So the first thing is bring it back in front of you. Yeah, so you can, yeah, go. Yeah. Hold the suture a little short, side, little long.
Yeah, like that.
Yeah.
And then
Nice.
Yeah. Then bring it back in front of you and switch
okay.
sides.
So then I switch hands.
Yes.
Okay.
Nice.
And then I do that.
Nice.
Yay, that's a nice little trick.
A little tight. Nice.
Switch hands again.
Nice.
Yeah, so this method kind of making you easy to get started
Yeah.
and have more fun.
Yeah. What's the sound?
If people try a few more laps,
Oh, wait. Switch.
come on.
Do it again.
Switch. Tina dance out.
Yes, that was hard.
What suture is? Is this a practice suture?
Or tendon, like for the Achilles tendon. It is 5-6 good long. Sorry, did you?
Nice. Nice. You put that super fast.
So microsurgery, one thing I want when I see the resident want to do fast, I always remind them to be fast is not moving fast, it's to be efficient. Because sometimes when you move fast, you will make mistakes. That's even worse. first one kind of suture. Now I want you to like be efficient. One of the tips is I first do I talk about that. Bring when we tie knot, bring the long end close to the short end, and just remove right above the short end, so we can avoid traveling. Like when we tie knots, nice and nice, keep the roots here, and then we need to travel here. Yeah, so one of the efficient ways is bring it here, and then take the root, then it's just yeah, that's the way of sometimes your teachers fast. It's not they move fast because they be more efficient. Here we bring it here, bring it here, so they move it right up.
Here.
So that keep in mind, bring the suture right above, bring it right above of the very close to the short end. Sometimes it's very easy to make a loop and it's very close to it, and that can avoid the suture come off of the video, so in the border of the percent.
Like right over it.
Like when we travel, sometimes we travel come off from one arm, and then kind of only get one arm anymore. And then at that time, we try to pull it out, but cannot because the forceps is all closed and then it cannot come off. Okay. Yeah, that's the knot tie method. When we get it better, we have an airborne method. Airborne method is like we hold the short hand, and so so this is and it's when you're doing the real surgery, you will see in the west space, when the short end drop and then attach to the west space, the face is really hard to pick up. So this method, we can always keep in the middle, short end in the air. That's the air one. And you will have more fun of doing that. And the Western, for me, when they pick up the skill, it will become the only method of time lapse. When I do microsurgery for demonstration, I need sometimes I need a reminder, people don't use this and that, they don't understand what I'm doing. And when that method sometimes still not they drop and goes to short end. So in some difficult situations, when I'm working in the deep space, maybe this one's method is this method. This is really 100% control of the long end and the short end. You understand? Yeah. So I'm holding two suture in the needle holder. So this method I can 100% controllable and
Yeah.
mostly. So this is another method we haven't published. Okay. That's suturing technique. And here, the last skill I want to share stitching method. My stitching method, why I want to share with you is because most of the time, when we're doing the stitch of a vessel, this guys still have a little bit more time. So this method, I think about when we're doing when we suture skin, microcreamy needle holder, regular needle holder. When we're using a needle holder,
Regular.
yeah, regular. This is a human step.
Just like a straight ring, but at least it's smaller tip.
Yeah. So when we're doing in stitching, we turn our hand and then stitch it back. And then it's in, like stitch this side, and then another side, we try to put it up like that way and come out. But in the microsurgery, when we need to like be holding the needle, and then when we try to turn, it's hard.
Yeah.
So actually we use our left hand to help to minimize the motion we have to do on the right hand. And also when we take the needle out for the exit side, if we still need to turn the needle, sometimes that's when the needle will bend the needle. So we also want to use our left hand to make us to take the needle out easier on the other side. So I would say in our teaching, we use the method like move forward method. Press down and move forward and move forward method. Okay. So I want to show you here. That's what I will rest. Put the needle here. We put a forceps here and then raise the edge. And then what the needle do is press down and we didn't turn the needle. We just move forward. See that? That can make you pierce the needle way easier. If you need to like you use the traditional method, you turn the needle perpendicular and then you turn, that's a little bit hard. So you just press down and then move forward, do it so nice and easy. And on the other side, if you stitch the vessel, sometimes the first stitching you just have to get out and go again. And if you use this side, you can use this method, but try not to hook it up, because when we go down and catch it, usually we will catch the barrel. That's very bad. It's one of the mistakes for 100% process the process. So what we do is, on the other side, we pick the needle in the air, and we pick up this other side, and put it on the tip. Now we are 100% sure there's only one more on the tip. Now, when we go now, if we use the traditional method, we just try to do it up, and what happens then? I bend the needle again and again, and I just study, and then sometimes the needles looking as snake. So what we do is we press it down, and then move forward again. So all we need to do our right hand is just move forward. Okay? And then after that, just
method is the same.
Okay.
Okay, yeah.
First,
you do it.
yeah. So you can minimize the motion we have to do on our hand. So we use both hands instead of just one hand. So usually, sometimes like when we stitch the doing the anastomosis, the first and second suture, I would like to use surgeon snap because there are some space, some gap in there. So the surgeon snap can go the first time in there, you won't get numbers. And other than, and then if there's not much tension, I just single knot and three knot. The first and second is kind of like if there's tension, it's a surgeon snap.
Alright, Nadia, you wanna try?
Push through.
Mm-hmm. Nice.
In the air. Just help myself through.
Nice.
Yeah.
Nice.
This
Yep.
is tight. See if we can tie.
And usually you'll have a longer suture than
Yeah.
this.
This is
Yeah, you
like a
can
challenge though.
But if you can do it with this, you can do it with anything, you know?
Yay.
test your limit.
Yeah. I really love that. Oh, I didn't do surgeon's knot. Let's try that again.
Nice.
Yeah.
You start by the needle holder. You don't hold the holder
Oh
on
yeah,
it.
you're right. You're right.
That's
You're right.
right.
I forgot. Okay.
Yeah, when other points. Oh,
It's okay.
Take it out.
Yeah, you can show me.
Yeah.
Okay. Okay. For the stitch, I will show you when you tie knots. Once more.
Where'd it go? It escaped. Over here.
Oh, shit.
How did it fly all the way over there?
Oh, nice. That happened. In my surgery, we use the nails, just cannot find
Oh
it.
my gosh.
Oh my god.
What do you
Yeah.
do?
What do you do?
But not only low, but it's a finger replantation, so I'm very sure there's nothing in the finger.
Yeah.
The nurse and natural, okay, you need to sign off.
Right.
It's your responsibility if the needle is in your finger.
Oh gosh.
But later we found the needle, Oh, where it is?
Where?
On my face mask.
Oh my gosh.
You look on the
Looking everywhere.
video, yeah. Finally, you look at me and oh.
Oh my
Oh
gosh.
my gosh, yeah. Yeah, you would have never found it.
Okay, so we'll switch hands. So I'll grab it with my driver.
Okay, I go. Now here, there's some small thing when we grab the needle. That's two way. One way is like you put it like this way. So this suture is in front of our needle holder.
Yeah.
So this way is easier. When we move this one, easier to use. And another way is if we keeping the needle still in this side and then try to reach out to it. When we reach out to it, bring back here. Okay, now this suture is like under the needle holder. So making it hard to remove. So this is so small. Yeah, so it's like over the needle and in front of the needle. So that's the first lesson. There's too many information. Too much information here.
Nice. Very nice. And then pass it over to yourself.
If you use suture,
I think the other forceps that doesn't have the little hole. I think this one's kind of hard to use.
Oh, I see.
Perfect.
That's a nice long suture.
Yeah, and as the assistant, like, I think one of the main jobs of our assistant is to make sure that the suture like doesn't get all the way through, you know? Like, oh, there it is, and then like grab it, and then like, okay, now we're good, and now you can go.
For a lot
A
of
lot of
times.
times, whenever the surgeon is like doing it, they're pulling it super fast, you know? So a lot of times I see the assistant will pull this up to them, like, you know what I mean, to like bring it to them.
Switching trick.
Yeah.
Can we do this for regular suturing, or is this like other side
Seriously?
towards the other side?
Oh, no.
No wait, is this like a thing that we can do for regular suturing?
I wish.
It's
not.
just,
It's
not
kind of
holding
holding
instruments
instruments in
up.
both hands, that's why.
I
I
thought
thought
it
about
was
the same thing.
Not.
No, it's been-
Yeah, you put it down. I mean,
the
biggest
biggest
fear
fear
that
that
bad
bad
seams
seams
are
are
really
really hard
hard
to grab suture with.
Okay.
I think that's
that's
my
fine.
Should we
understanding.
keep this?
Oh, I'm so sorry.
That's okay.
Are you good?
Yeah, just stabbing me. That's okay.
Oh my goodness.
Okay.
I'm trying to find it, yeah. That's another hard thing is like you lose
It's like
like
where you are.
In the other way.
It's hard, so you have to like
improvise
improvise
my
on
tummy
it,
as you
bring it
to
here
here
and
and you
slide
slide
it
it
down.
down.
Yeah.
Example, catch the suture and hold all the way.
When do you want to do it? I don't think you looped. You didn't loop.
No, didn't move. It's also kind of hard here. Can you move it to the side a little bit? Yeah, it's kind of hard to see when it's directly up too. Up and down.
Nice.
Nice.
Queen.
Weifeng, I want to learn the air tie. It looks so cool.
Yeah, everyone
They, after they saw that,
they want to do that.
There's wants his black belt.
Oh yeah, I'm not good enough for it, but it looks so cool.
Then you can only tie airports in the future. That's what you used to
Yeah,
have.
that's true.
Wait,
Yeah, sorry, I was just trying to.
right there.
I don't think I can tie a regular, it's
yeah, well, once you got them, that they come your own step. So, microsurgery, microsurgery, a lot of things is from general surgery. It's, in my teaching, I don't want to make a student or the resident feel, oh, it's totally something new. It's scary with that. Actually, every step, even tying knots, even handling the suture, we have an anchor from what we have. We already know.
Yeah, I'm just like trying to practice like finding it in space. Without like having to like leave the microscope, you know?
Yeah.
Alright, now your turn.
Thank you.
And the thing I was taught is whenever you're putting in the initial or the suture, to try not to grab the vessel because
Right.
it'll damage it.
Yeah. Grab the big vessel just to smooth it out for myself.
Yeah.
Oh,
But you know, yeah, exactly. Yeah.
this one just push
To
through.
use like a lot of so instead of doing that, yeah, you use like opposition. Nice. Also, it's kind of crazy, but if you like look at the suture, you can see everywhere that we grab it, it just like damages the suture
Yeah,
pretty
totally.
significantly each time.
Yeah.
Oh, okay, we're good. I thought
we have a video on
our YouTube
channel.
channel.
Yeah.
Thai nuts,
So,
apple nuts.
Okay, looking at it. Now I can do my Friday night plans.
Slow down. Yeah, slow down.
Oh.
One thing at the beginning I said slow is fast,
Yeah.
and later I learned something new, and adding one thing in between. Slow is smooth, smooth is fast. That makes more sense. The microsurgery in the anesthesis part and in the dissection part is really important. Dissection is before we do the anesthesis. We need to make sure we have a healthy vessel, low damage vessel. So that's important. And anesthesis is the last step. It's worth to spend enough time to make sure we keep everything in the right way at the beginning instead of repeating it or make a mistake and then have to do it. Even worse is a fractured back at night. So after a long day,
No fun.
yeah, it's totally
Hard.
so to have a higher successful ways to slow down, do everything right, and make sure you succeed everything. No guessing. And after that, sometimes I feel the confidence from you see everything. No, not any step is like guessing. It should be. Probably is why I didn't catch those very well. Don't keep that doubting in mind. Make sure you see it. You make sure everything is no guessing.
Right. I have a question for you. What's the best way to stabilize the hands? Like, I've seen people put like towels under their wrists.
And,
Like, you know, like, is it better to have your wrist angled like this, or like resting like that?
like you're writing,
Yeah.
right? If you do microsurgery, it's like the motion is really from your similar to writing. And when we writing, if I read rather, you only use fingers. We didn't move like that way. But sometimes when we do micro, we move the whole hand. So when you feel hard, go back to the way we write it. Right? Yeah, just rest your hand. No, find any possible, any like walking on the arm, our hands here. No, it's not good. So ask for some power to your arm, to your hand at the same height of the surgical field. And rest your hand on the field. And I have a feeling I should have something coming out of it.
Tail's getting short.
Yeah. My way, my job is to make square like that.
My job is to inspire
The
the
next
next
generation
generation
of microsurgeons, and he's doing a great job.
Thought I would be a
The
microsurgeon.
only way you have fun, you want to go to microsurgery. If you feel hard at the beginning, you probably okay. Maybe other maybe. Because microsurgery, there's a lot of specialty.
Yeah. I mean, this is a lot of fun.
Only way you feel have fun when you go to those posts. Yeah, microsurgery is still the very, very tough specialty. But we can do a lot more things. And one day I remember last time I asked a question of the prospective surgeon, I female surgeon,
Yeah.
asked her for what he did. She did DIB micro also, and I asked her opinion is microsurgery that contribute to your cosmetic?
Tactic?
Yeah.
And she said exactly. Yeah. Surgery is like you need to do everything good. So if you do micro good, that means you have a good hand, you can do cosmetic surgery very well also. And she also make a joke, right? And also if you can put a TY in a very good, maybe also that means you can do my two classic cosmetic surgery very good.
So funny.
Remember, she doesn't like TY.
Yeah, I
I
remember.
remember she said that so many times. That was funny. This is more fun.
Trying not to grab it. It's very difficult though.
Yeah. There you go. Nice.
It's too long. Grab here.
Yeah.
So now microsurgery, if you do it by yourself, you make a lot of. Eventually, you will be good. Like it's like us, like we didn't have teacher one-on-one teach you. The teacher just showed you a couple steps. Okay, do it this way. And then we make a lot of mistakes. And slowly we're getting better. But when we're getting better, we don't know what has been changed in our hand. Yeah, I figured out when I started teaching. And then I see the rest of the struggle here and there, and then I saw, oh, that's me, that's myself. Before, and then I compared with what I was doing now, and then I realized there's some small difference, small detail, and that's the small detail making it easier for the beginner and have more fun. That's one, probably is one of the suture, the loop come off from one arm of the, what's that?
I keep saying my fingers and I'm like, oh, I'm choking up too much on them.
It is like so much fun just to do this. Like tying the same knot like 100 times, but it's still just like enjoyable.
So our resident also rotate here and here, something.
Yeah.
Here, professor, the classic survey resident, then for microsurgery, yeah, 2 years ahead of us.
Really?
Now even more.
That's awesome.
Like Katie,
All to you.
and they also they are willing to learn.
Yeah, well,
And like Katie is even making beyond that. Katie was second year in when she was still living in the EMT. But Pharaoh cannot do all the micro case, so she went on the micro case and she did the osmosis.
What? At the too? Sheesh.
So it's like up 2 years ahead, it's 4 years ahead.
That's amazing.
Some of them.
Yeah, she's a genius.
Yeah, the professor said you are doing micro lab. So,
Wow, Katie, that's awesome. I remember the microsurgery course. She sutured like a 2mm vessel or something.
She did a super micro.
Yeah,
What is it? It was like a 0.5.
oh, maybe it was a point.
Yeah, it was crazy.
It was like 0.5.
JP was very impressed.
Yeah.
So if you can do this, I'm gonna be
JP
impressed.
told me
She did it.
Like, yeah,
good
good
job.
job, Sam. Katie's coming for him.
Yeah, Katie's a rock star.
Whenever
Whenever
it
it
gets
gets
small
small
like
like
this,
this
I think
Weifeng,
it's
it's
hard
hard
to
to
sometimes.
sometimes angle it right.
I think for yourself, that means you can teach, you know.
No,
I
I-
get it.
So sometimes very focused, you cannot see it.
Alright,
Well,
well,
that's
that's
good.
good. Yeah. I think like what, 10 is the limit?
Looks like it.
Very nice.
Awesome. Sweet.
Yeah,
Thank you, Weifeng. This is awesome. This is so much fun.
yeah.
I think he teaches there, not
Ella? Not at all.
That's okay. He said walk before you run.
Okay, and one more now, use this picture.
Yeah.
Oh, 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 it's
No, okay.
I can finish the suture. Or Nada and I can both if I don't want to speak for Nada.
let's wrap up and then if you want to keep practice, because I have to go and we can take our time.
Yeah, for sure.
Yeah, of course.
Yeah, and then stay here.
Sorry.
Come here.
This was awesome.
Come here. Hi, hello, everyone. Now, yeah, it's 2 hours. So actually, we didn't feel that's 2 hours. Usually, yeah, I feel like just like 1 hour or 30 minutes.
Okay.
Yeah, we have fun. And yeah, today I walked Nada and Ferris through the microscope, suture, and instruments, and then we start tying knots and doing stitchings. Some of the small detail is really important for the beginner to help them to be easier to get started. And yeah, Nada, share like 1 or 2 points now in your mind you feel today is helpful or fun, and yeah, to
Yeah.
have.
I think what's helpful is just going through what each of the instruments are and what all of the numbers and letters mean. Like from an educational standpoint, it's good to know exactly what you're using and what it all means. And then you know, showing us all the advanced knots is super fun. So we'll start with the basics and build up our skills, and excited to get to those advanced ones one day. We'll get our black belts. Yeah.
Yes,
it's super
yeah.
fun.
Yeah, I like that story.
Yeah.
Yeah, and yeah, first, yeah, share like a couple points you feel today is helpful when you practice.
Yeah, I think one of the most important points that I learned was how important having an assistant is, and having an assistant that, and kind of understanding what is important to do as an assistant to really make the surgeon's life like more easier to suture and more efficient and faster.
Yeah, that's some of the principle we when we get started, and then we learn it and keep it in mind. Like for example, like the efficient is better than be fast, because fast is high risk of introduce the bias or mistake into the surgery. And I mean, microsurgery it takes times, but if we are microsurgeon, we pick this as our career. So every minute, every second is our life. We don't want it to go away fast. So slow down and enjoy the microsurgery. Yeah. Yeah, okay. If you like our channel, if you want to know what we are talking about, go to the video and watch it, and give us a comment if you have any thoughts